I do want to thank US Soy for the opportunity to speak this afternoon. This is a fun experience for me to revisit some of my thesis research that I did at University of Illinois. And really the type of research that prepared me for what I do currently, which is looking for ways to leverage nutrition to improve clinical outcomes in disease-challenged pigs. As mentioned, this presentation of the results and the clinical description of the challenge that we created is from previously published research. And the trial was conducted during my PhD at University of Illinois in Ryan Dilger's laboratory and was funded by the United Soybean Board. So soy protein is the most commonly utilized protein source in US commercial diets. We do have some challenges to face around that weaning transition, however, due to the limited digestive capacity of the weaned pig's intestinal tract to utilize plant-based protein. So for that reason, we typically see limited levels of full soybean meal in those diets. However, developments of additional processing techniques can make feeding that protein more appropriate through improvements of digestibility and the removal of anti-nutritional factors, which again, negatively impact digestibility, can also cause direct damage or irritation to the GI tract. So in addition to that nutritional transition stress, we have a myriad of other factors that are going to put more pressure during that transitionary period. So that's going to include the weaning and social stress of that event, as well as the mixing of a new population. Transportation conditions and durations can be highly variable in what those pigs are exposed to. And then pathogenic stress. And I think we can all agree in the industry today that's a factor that's very active and hard to control and manage, not only from a nutritional standpoint, but across the board as far as health and husbandry. Dean mentioned previously, we've seen that high soybean meal diets can improve growth performance and whole body and carcass lean tissue accretion in these pigs. So the question becomes, was this improvement due to bioactive components within the soybean meal or just an increased availability of the amino acids in those diets? So between those two questions, Ryan Dilger's laboratory chose to look at the bioactive fraction and try to understand what is happening with those under disease challenge. And the focus of my research was on soy isoflavones. So soy isoflavones are a naturally occurring bioflavonoid compound found in soybeans. And their content can vary depending on how that bean is processed. So they are thermally stable, so the production of soybean meal or further processing techniques that would utilize a thermomechanical process, that fraction is going to be relatively unchanged. But when you look at products like a soy protein concentrate or an isolate, and the goal of those is to increase the protein fraction of that finished product, as well as removal of some of those non-soluble carbohydrates that can create an anti-nutritional effect. And what we see is you will get removal of not only isoflavones, but saponins as well in those final products. So I'm bringing this up just because it comes into play with our experimental design, but these are the three isoflavones that are present in the soybean: genistein, diazine, and glycine. Of those three, the one that's probably the most well categorized from a bioactivity standpoint is genistein, followed by diazine. But we can see when you further process to concentrate, you get a product that we would consider practically devoid of isoflavones, and then an isolate is some intermediate reduction in isoflavone content. So moving on to the respiratory challenge component of this study, PRRS is really the virus that needs no introduction in our industry. But what I think makes it such a hard virus to manage outside of its ability to mutate and change over time is the impact that it has on the normal immune response. That's going to, one, make it harder for that pig to get over that PRRS challenge in general, but also make them more susceptible to secondary infections. So as an immunology review, your normal viral response is going to involve both the innate or first response immune system and adaptive or recovery and clearance. And so typically we see an increase in that type 1 interferon release, and that aids in the decrease of viral replication. It increases antigen-presenting cell activity and antigen presentation, and increased cytokine production. And what that does is that helps recruit and activate the adaptive immune system, so you see increased activation of lymphocytes and natural killer cells, increased targeted cell death, increased activation of B cells for the humoral arm of that adaptive response for antibody production, and that's all to result in long-term clearance. What PRRS does, though, is it delays this type 1 interferon response at the start of that immune response. And it's not to say that PRRS response is doing anything to the level of inflammation that an innate system creates. We can all agree, especially the field virulent strains out there today, they're extremely inflammatory. They create robust inflammation in these infected pigs. But this delay is going to provide an opportunity for increased viral replication of PRRS, and then you also get a delayed or a truncated activation of your antigen-presenting cells and cytokine production that is going to slow down the activation and recruitment of your adaptive immune system. So you get delayed neutralizing antibody production, or the antibodies that would actually help with viral clearance, and you get persistence and delay of clearance. So how did soy isoflavones fit in this? They have a number of bioactive properties, and I'm going to try not to steal Ryan's thunder for his talk, and I'll let him go into more of the detail of these, but to set why we would be interested in them in the first place. They do have estrogenic activity. They are a structural analog to 17-beta estradiol, and so it can act as a weak analog for that. I am going to go into a little bit of mechanism here because I think it might come into context with some of the clinical response, but the immune system also has estrogen receptors. They're predominantly the beta estrogen receptor, which isoflavones preferentially bind. But these would be present on peripheral leukocytes, tissue macrophages, and pulmonary epithelial tissue. And they can have both pro and inflammatory impacts depending on the pathways activated. But on a pro-inflammatory stance, we can see increased apoptotic activity with binding to that receptor, and we can also see increased recruitment of neutrophils. So keep that in mind as we look at some of these clinical responses. They also have direct anti-inflammatory and antioxidative properties, and then particularly in vitro models of cross-species viral challenges, we can see direct antiviral activity. So there have been groups outside of the Dilger lab, but within the Dilger lab as well, where we looked at the impact of soy isoflavones under PRRS challenge specifically. And previously, we've seen that isoflavones can improve growth performance. It can decrease serum viral concentrations and improved supportive adaptive immune response as defined by immunophenotyping of peripheral effector T cells. So we know it has the potential to do something to alter the immune response to PRRS. So the question that remained was, how are they influencing the immune response to PRRS if they're provided at normal ratios or levels in the diet? And can the underlying biological mechanism be identified? So the objective for this one was to look at a long-term effect, so feeding soy isoflavones from wean to finish, and its effect on the growth performance and acute and adaptive recovery response to PRRS challenge. And our hypothesis was that the pigs that received isoflavones would demonstrate a stronger immune response, better performance, and a less severe clinical presentation over that growth period. To do this, we used 96 weaned barrows, around 15-pound wean weight on average, and they were allotted by random block design by their initial body weight. They were group housed in a BSL-2 rearing facility that allowed us to group house pigs at 6 pigs per pen and 4 pens per room. Due to the ventilation of that BSL-2 facility, we were able to maintain one uninfected room, so all of the replicate pens for uninfected were in that room, and then for our other 2 infected treatments, they were equally distributed across the 3 other rooms. So we have 3 experimental conditions that go into 3 experimental treatments that we had. We had 2 infection statuses, uninfected and PRRS infected. That NADC20 strain has been described as a moderately virulent PRRS strain and had been commonly used in challenge models. We had 2 levels of isoflavone supplementation, no supplemental isoflavones, or isoflavones included at or above 1,600 milligrams per kilogram in the diet. And to achieve the no supplemental isoflavone, we used that soy protein concentrate product that is practically devoid of isoflavones. Pigs were allowed to acclimate for 7 days prior to inoculation, and the diets were fed across 7 phases, 2 for the nursery and 5 for finisher. And they were formulated to be appropriate for life stage and meet or exceed NRC nutrient recommendations. The isoflavone concentrations were kept constant throughout the study, and that 1,600 milligram per kilogram target on formulation is to represent approximately a 20% soybean meal inclusion in the diet. And that would be, if you looked from wean to finish, kind of standard commercial formulation, that'd be about the amount of soybean meal we'd expect a pig to be exposed to through that period of time. So with those conditions, we have 3 experimental treatments. We have a negative control, a positive control, and our isoflavone treatment group. PRRS did as PRRS will do, and we induced our model, and with that we did see presentation of severe secondary infections that started to present around 10 to 14 days post-inoculation. Based on the clinical signs observed, we speculated it was likely a strep suis or a PRRS secondary infection. It responded well to antimicrobial treatment, and we can see here on the timeline that antibiotic was provided to all pigs on study, so including the negative control. Here we have the experimental timeline and the measures that were collected for this experiment. For pen-based outcomes, we did performance and oral fluid viral clearance. And then individual outcomes would be what we would consider our health indices. So anything from blood or rectal temperatures were measured on an individual pig basis. Statistical analyses, single time point outcomes were a 1-way ANOVA. Repeated were a 2-way ANOVA sliced by days post-inoculation. We did our mean separation by treatment for single time point, and then treatment by DPI for our repeated time points. And replicate pen was included as a random effect. So we're moving into the results now, and I don't have all of the results from this study, but what I do have is what I think represents those that help emphasize the clinical relevance of what we saw when we supplemented isoflavones. So first to start is growth performance, because in the past, isoflavone supplementation has benefited growth performance. In this particular study, we didn't see any consistent effect on growth performance parameters by supplementing isoflavones. The biggest impact we saw was due to challenge, where you can see the separation of the negative control group and our positive groups, with the negative control being heavier and maintaining that heavier weight until market. We did see that isoflavone treatment group had decreased body weight at the end of the live phase of the study relative to the positive control. However, several days later, when those pigs were sent for harvest, there were no statistical significance in their weight differences. So whatever difference that we found at that live animal phase completion was not maintained at market. So looking at rectal temperatures in that kind of acute infection period, so up to 13 days DPI, we did see some differences at our day 0 between our negative control and positive control and isoflavones, but they're all below or within a normal physiologic range, so it's kind of hard to understand if there was any relevance with that difference. But looking at DPI 6, what we do see is our positive group having an increased rectal temperature on average compared to our isoflavone treatment group, suggesting that potentially that febrile response to that viral infection was more pronounced in our positive control group. Looking at some differential blood cell counts, we can look at total white blood cell count as well as the lymphocyte count, and we can see that the shifts in those populations reflect what we expect PRRS to do to the immune response. So our negative control, they do have an increase in white blood cell count post-weaning as well as that lymphocyte count, which makes sense. They're in that post-weaning period. They've had that transitionary stress. We should be seeing some increases in this relative proportion as that adaptive immune system kind of adjusts and overcomes. But what we see with our challenge group is in that first 6 days post-challenge, we see a suppression in total circulating white blood cells, and we see a suppression in that lymphocyte population, which was to be anticipated. What I thought was an interesting finding, however, is when we look at neutrophils. So for our negative control, right, we are seeing a decline over time of neutrophils, which I think would be expected. But when we look at our positive control group, we see a dip around day 6 and then a rebound by day 13. But if our isoflavone group, they just continue to increase. Now, neutrophils are not typically affiliated with a standard viral response, but as I mentioned with the estrogen receptor beta activity or other potential pro or anti-inflammatory pathways, there may have been more recruitment of neutrophils, which given the challenge and knowing that these pigs faced a secondary bacterial insult, this could have come into play with some of that clinical response that they had a higher neutrophil count during this period of time. So looking at viral clearance, for this particular study, we didn't see any differences in serum viral clearance between our positive control and our isoflavone group, but we did see a little bit of shifts in dynamics of oral fluid clearance. So looking at our positive control group, so these would be our individual replicate pens, and we can see that they reached an initial negative event a little bit earlier than our isoflavone group, so that DPI 60 versus DPI 74. But what we did see is in half of these pens, they would circulate back to positive. In the case of 4 and 6, more than once. But our isoflavone groups did not tend to revert back to a positive status. I think it's also really interesting to point out that replicates 5 and 6 would have been within the same room. So you have these 2 pens that have either prolonged positive status or reverting back to positive status within a room of pigs that one did not. So there's a little bit of shift in dynamic of clearance out of those populations. Another way to look at viral clearance is the production of neutralizing antibodies. And unfortunately, I don't think my gray is showing up very well here today, but anything over a 1 to 8 titer is considered PRRS protective for this particular assay. And we looked at the shifts of neutralizing antibody production over time. Another way to look at this is the individual count of the pigs collected. And what we see is we have increasing amounts of pigs with protective titers. We did see 100% of our isoflavone group reach that protective level a little bit earlier than our positive control group. But by that 34, they both did, but that little bit of earlier clearance might be clinically beneficial. So one of the most interesting findings is not necessarily one you want on a controlled challenge study, which is you have a robust mortality events and looking at the differences there. But what we found was interesting. So we can see in that post-challenge period, we start to see mortalities increase around that week post-inoculation. And we had our antibiotic intervention around 21 days post-inoculation. Following that administration, though, we start to see our isoflavone mortalities plateau. But our positive controlled continued to increase. And what that resulted in was that approximately 50% more mortalities for our positive control group relative to the isoflavone treatment. There were no statistical analyses done on this, recognizing that these are low numbers of animals to evaluate, but I still think it's one of those findings that you do need to pause and consider when you're looking at this is a pretty significant effect of pigs that were housed together, exposed to the same amount of antibiotic intervention, but still seeing that separation there. We can think about mortality as just number of pigs saved or number of pigs making it to the end of the period, but I think it's really nice to assign some monetary value to that. So with the help of my colleague, I was able to take the final harvest live weights of these pigs and model them on 3 geographically relevant packer grids. So these would have been reasonable facilities for these pigs to have been marketed given their location. And what we see is the increased number of pigs marketed in that isoflavone group resulted in a proportional increase in projected revenue. And we did see some shifts in the classifications of weight penalty classifications. So you do see some up and down movement of extreme lights, or extreme heavies in the case of Holstone. But even with those moves shifting around, we get that improvement in revenue. Those are those same numbers in a table form. As I'll point out, if we look at our positive, that average revenue per pig is a little bit better than our average revenue for the isoflavone group, and that's due to a greater proportion of those isoflavone pigs being within a penalized weight category. But because the isoflavone group was able to market 6 more pigs, that resulted in that approximately 30% increase in revenue, which really demonstrates that the quality of the pig following a PRRS insult may not be what is ideal. It's not going to be your most profitable pig, but getting pigs out the door, survivability, that livability component is really important and something that we focus on a lot when we're thinking about nutritional support is just, can I get that pig to live? So for conclusions, there were minimal growth effects for isoflavone supplementation in this study. We did see an increase in those neutrophil counts in early infection, and then we did see some dynamic changes in the time to full viral clearance. The isoflavone treatment group did result in approximately 50% fewer mortality events than the positive control, and that reduced mortality estimated to result in approximately 30% increased projected revenue. Our takeaways is it does appear to impact the clinical response to PRRS infection. As mentioned, that reduced mortality is one of the most notable findings, but it's still difficult to apply that on a commercial scale and understand what that would look like under standard production. And it's still a little unclear of what the biological mechanisms, and Ryan will talk a little bit more about some of the mechanisms actions that we speculate are at play here. So with that, thank you.